stand and say our pledge together and have a moment of silence. Let's face the flag. Attention, salute. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty and justice. Let's pause for a moment of silence, please. Thank you very much. Is there a motion to adopt the agenda for this evening? So moved. I have a motion, Mr. Groves. Is there a second? Second. Second from Mr. Rubin. Any discussion? All in favor, aye? Aye. Aye. Opposed, no. So ordered. Just so everybody's aware, the only topic this evening is our posture in returning to school. So while there is public comment on the agenda, the intent is that public comment is focused on only that topic. So beginning this evening, Dr. Grimsley has her remarks and her data to share with us.
Thank you, Mr. Chairman, members of the school board. I have prepared a presentation for you as directed, which will give an overview of where we've been, how far we've come, and where we are now moving into the school year, as well as present to you some of the latest data for your perusal and consideration. So if you recall back in the spring of 2020 when schools were shut down, we developed reopening planning teams pretty much immediately as soon as that happened on March 13th. Many months of work went into this. We actually had 9 different planning teams for such a small district to look at all of these different areas that we knew were going to be so important moving into the school year. Those teams were made up of stakeholders and health professionals, teachers, parents, and they met over a period of time, about 60 days, and then presented the reopening plan prior to the start of school in August of 2020. What we tried to do was develop a dynamic, data-driven decision-making process that really took out any emotional response or political response or anything like that to what was going on, because emotions were high, anxieties were high, so we had to make sure we anchored the system in the data and what was actually happening around us. Otherwise, we can all get really lost in trying to grapple at solutions to things that we fear. And of course, things happening in the media and the politics and everything, just kind of conglomeration of difficulty for people to grasp. So that was very important at the get-go, that we created a process that was really grounded in the data and what was going on in local context. Pretty soon after that, our system actually became a model across the state, and we even received some national attention for it, and it was replicated throughout the state. BDH and BDOE developed guidance that actually used some of our measures too, which was pretty neat to see because we had gotten ahead of the state before they released anything. So the guidance that used was a 5-step process where it's not just one indicator of data. So you have a self-assessment of how well you can implement mitigation strategies, the level of actual school impact with your school community in the building, the level of community transmission, understanding your community's needs, and also deciding how to prioritize in-person learning and which groups of at-risk students you need to address that are prioritized learning. New to this, they're going to incorporate considering vaccination rates both for your school community and the community at large, and there is a tracker for that, and we'll talk about that in a minute. So assessing mitigation strategies, last year we had well over the 5 necessary to create a safe in-person environment. We were open the entire time and offered 4 days of in-person instruction for our prioritized groups right away, and even had an application process so that students could apply, parents could apply to have their students in 4 days depending on different circumstances, whether it be financial hardship or lack of internet access, or, and as space allowed, we allowed more students to come in for 4 days. We had more than the 5, so we automatically got the excellent checklist on that checklist. Here's some of those mitigation strategies. This year coming in, we have added some kind of in anticipation that the mask mandate may fade or the emergency orders would be lifted, but still wanting to be safe in school, especially for our primary grades, where we know the younger students share a lot, and germs are part of that. So what we've added with our ESSER funding is additional sections of classes, another kindergarten teacher, transition rooms, so our class sizes are very low. So what we can do with that is socially distance much better, even better than we could do last year. And remember, we stayed open during the height of the pandemic without any vaccines using the system. So adding on some additional mitigation there too. So when you determine the level of school impact, what that looks like is a low school impact would mean 0 or even sporadic cases with no evidence that they were related or transmitted together. So that's what we generally saw last year. As cases did pop up here and there, they were pretty isolated. We didn't have to deal with any outbreaks. Even the one transmissible connection made with the wrestling team was not a widespread outbreak. It was a very isolated and contained event. So this is what the metric looks like for that. And as you go into the medium to high, we layer on more stringent mitigation practices. I think some parents in the room probably remember at one point in the year, and I'll show you the data table for that. In fact, that's the next slide. So this is last year. So you see how we were in September through November with the case rate per 100,000, which is kind of problematic in itself when your population is 7,500 or under. Percent positive school mitigation, those are your primary indicators first. And you see in December how we had a consistent level of red there in December and on. So that's what we use the case per 100,000 for. It's more about tracking trends because it's not really accurate. Skews with just a couple of cases can put you into another category daily. Okay, so I know there was a news story that came out on NBC or something that said we were in substantial and high and watch out, and it just wasn't the case. We had 2 cases, so it kind of threw us off, and that's only one metric too. But in that time period where we saw a consistent trend upward with that case rate, what we did was layer on additional mitigation and quarantining procedures. So if a student came to school symptomatic, then that's when we did our automatic 10-day. If a primary class had 1 or 2 cases, we would quarantine that entire class for that 10 days just to watch, monitor, contain, and be sure there wasn't an outbreak in the school. Worked very effectively even at the height, and then we didn't have the vaccine available to anybody either. The secondary indicators, this was last year. Again, you see kind of the same thing in the rates of change of cases in that same time period. So we monitor these and we watch every indicator period 7 days and then do a 2-week update on the dashboard. Understanding the community needs, just knowing your community and the level of access they have to things like food and internet, and what does the school really provide. In a rural community, the school provides everything. Okay, so we're the hub of the community and we have to be open. So being open was never negotiable for us. We had to be open for our families. And then deciding different student groups and timeline for prioritization. If you're even at the highest level of community transmission, schools should be open and prioritizing learning for at-risk learners especially. And we'll get into some things that have changed this year that were a little different than last year with that. So we also developed a COVID response logic model so that we could, very clearly articulate what happens in scenarios. If I have a single positive case that has no known exposure, this is how we react. Single positive case, primary classroom. This stuff was all published last year, and that what our reopening teams worked really hard to create, and also our COVID team leader, Courtney Atkins, and school nurse at the high school, ran a team that helped refine this throughout the year. So different scenarios, 1 or more cases that are related. Thank you. Sorry, it falls asleep on me. I didn't think I was that boring. Oh. Multiple outbreaks, so different scenarios, and this is how we respond, and this is what happens. We send out a COVID notice. Even though it's not required anymore, we still plan to do that. We think it's very important to empower our parents to make the right decisions based on the actual information. So we will still notice parents about, okay, there was a positive case in this building, and so we will make sure we still do that. The local contact tracing process. This got really frustrating as time went on and VDH got more and more swamped with cases, right? So we were at times waiting, several days to find out who was exposed and whatnot. So you have to close school, right? Because I may have a bunch of exposed people running around infecting other ones. So we developed a local contact tracing process where our school nurses can interview. They were trained by VDH too, so they know all the checklists. They can respond immediately, quarantine those, isolate those who may need to, and working with VDH too. And we knew pretty much immediately. I think there was only one incident where we had to go to distance learning for one day for for the contact tracing process to continue. So that's worked really well too. And that's not going away. We still have to deal with this, so it'll be the same process this year. So the illness guide, presence of symptoms, we use a COVID symptom checklist. We will use that again and ask all parents to make sure they do not send their children to school with any of those symptoms, and keep your child home if they're sick. Risk of exposure, if you're sick, the old definition of close contact was within 6 feet of a positive person for a cumulative 15 minutes over a 24-hour period. Now it has changed in a school setting. Between 3 and 6 feet, if both parties are masked, you don't necessarily have to quarantine. The community transmission is something else we look at in all those data points that I showed you. We also have symptom scenarios. So what happens when a child is sick at school? So there's a higher risk factor depending on what the community transmission rate is. So if we look at a higher transmission rate, then we know it's probably likely that the symptoms, especially 3 or more that are aligned to COVID, could be COVID. So we treat it that way, especially if our community is in high transmission, which we've been at before. And that's where we do the automatic 10-day for children. And parents really did well with that. I mean, as we gave data, and we were trying to be very transparent with when the cases were popping up so they could make those decisions and help us and cooperate, and generally it went really well. So last meeting, the school board in July gave consensus to continue using this system, a data-driven dynamic decision-making matrix, for layering additional mitigation as data indicated. Masks at that time were strongly encouraged for unvaccinated, but not required. The data dashboard we use is the VDH school metrics among one of them. So I've pulled some recent data off of this. So you can see as of 7/24, the lines where they are 3.4% positive. The 13.79 is that case per 100,000, like I said, but it's still really relatively low if you remember where we were looking before on those charts. 90-day trend as of yesterday, I mean, those are pretty flat curves, so those are things we look at too, and even regionally, any spikes. Our Tier 1 indicators, here's the current graph of the same dashboard we use. All looks pretty decent in the green. This one too, Tier 2. As of July 24th, when the last indicators were put up on the dashboard, we were down in change of cases. 100% of the hospital beds were occupied, but 0% with COVID. So that's encouraging. So remember where we were last year, see how the difference in the data tables, which in that case, we would completely shift and start layering on some additional mitigation if we saw trends going to that level. But again, these look pretty decent and pretty similar to where we were even before the July meeting. So other data, community buy-in with the mask policy. I was directed to conduct a survey of staff and students. It's hard to see, staff and parents. So what the pink on the right is the responses. In pink, almost 60% want to keep it the way it is. 31% said, well, we should just mask everybody. So the biggest gaps were, it was either all or nothing. And then there were 4% wanted to mask just the elementary school, 3% just the students at the elementary school, and then 5% just all the kids and not the adults. So that's the way the survey came out. Again, perceived need surveys are just to give us some kind of level of data points. We don't generally make decisions based on polls just because there's a lot of other mitigating factors too. But it does tell you a lot about buy-in and the cooperation and compliance you might get if you do something of that nature. So it's important.
So this was parents of students.
Yes.
No.
And staff.
Parents and staff.
Parents and staff.
Yes.
You know how many responded?
If we had well over 350 responses
350.
within the first couple of days. Yeah.
Good.
It was, that's a great response to a survey like this, honestly. That's a better response than we get on most things. Other data that we look at are vaccination rates. In the county, we are kind of low at 22%. But as a staff, remember you look at your school community, we had 60% of our staff sign up for their first vaccination way back when. We can't track it after they get into that system unless we explicitly ask, and we don't have a policy to do that right now. But that's really encouraging that 60% initially requested it, and I know of many more who have gotten it since then. So I feel like we are well above what the county rate is in the school. So what's changed? The data hasn't changed much here, but what's happened since before was the expiration of the Virginia state of emergency that expired, expiration of the Executive Order 79 restrictions. The Health Commissioner, remember, extended Executive Order 79, especially for students in summer school, and that expired on July 25th. And then Senate Bill 1303 is something very different than what we had last year. So this one is the bill that was enacted by General Assembly that says schools must provide in-person instruction for any parent who wants it. So that creates something a little different than we dealt with last year. So for this year, either way, compliance and punitive measures may become either a legal or ethical issue depending on your stance. So you just need to be aware of that. CDC guidance, AAP, and RRHD at this time all align, and they all say that they advise masking indoor settings in schools of everybody, regardless of vaccination. VDOE and VDH still says advises masking of unvaccinated individuals, but I expect them to probably revise more aligned to these other agencies. Just that's generally what they do. Variants of concern data. We've heard a lot about the Delta variant around in the area and lots of transmission of that. So these data tables are here. They came up a little.
Nobody can see what.
I know, it's hard to see these, but.
The light blue and the medium blue and the dark blue, the numbers for that.
Yeah, so we're in the lower section here with the northwest.
No, we're in the middle blue.
Right here. You see in the middle blue, yeah. So in the middle with the Delta variant, as far as deaths, 2, 3, 4 deaths so far from Delta and all 60 and over population. So far it hasn't really, as far as deaths goes, hurt the younger children, thank goodness. The Alpha seems to be the one that's more detrimental to younger children from the data on their dashboard. Other counties, what are other counties doing? So far from what we could ascertain, Clark is going to require, Shenandoah has them optional, Page has not made a final decision yet. Fauquier, Warren, Culpeper, Mass are optional there. Orange and Madison have not made a recommendation yet. And then we pulled some other rural counties, Mass optional, in Amherst, Tazewell, and the whole South Central region, pretty much Mass optional.
How about Governor's School, which were part of a consortium with Mountain Vista Governor's School?
Most of Northern Virginia schools are going with masking, including Clark and Winchester. Mountain Vista Governor's School is going to require masking, yes. So that is my presentation for you, but after going through all of this, we met as an administrative team yesterday, and we still feel comfortable with the recommendation to start the school year as we said in July, right now. But with the understanding is that we have to adapt with the data as it reads.
Okay, specifically, what would that be?
Specifically, what would that be? So just like before, so if we saw, we would layer on additional mitigation strategies. Now, masking may present an issue, like I said, if you mandate the mask. However, when you empower people with the data and say, okay, we have, let's say, an outbreak in the primary wing, we really encourage parents to mask their children for the next 2 weeks. Generally, they're going to do that pretty well. We saw the same stuff with the mitigation that we had to layer on with some of the other pieces. So just to keep in mind. So mandatory masking, it looks a little different this year without any emergency order or executive order to help you enforce it. And that's where Fauquier went ultimately, is we don't know how to really enforce this if we did it. So there's those pieces too. And then there's the health belief model, theoretical foundation too, when you empower people with the data and they do the risk reward balance, that they do make the right choice when they see the actual data and the risks in front of them. And that's a premise of a lot of health models too. So something to consider. So Any questions?
Could
Well, I'm
you
sure
speak-
there will be some questions.
Yeah,
So,
I have a question. Could you speak to the, we're doing 5 days a week now, so that's more. We also will have more students in school because there are some who are all, I'm sorry, I can't really see you or
That's
the other
okay.
board members. But there's not, I'm just curious how much more dense, I know you said we have in the youngest grades, have
Mhm.
smaller class sizes.
Right, so with the younger classes where we would expect a higher transmissibility rate, we used our ESSER funds to create additional transition classes. So we have some classes as little as 11 or 12 students in a classroom. So
I'm
we can
just thinking
distance
about system-wide, especially
Mm-hmm.
with, for everybody, anybody in any class.
Right, and the
Yeah.
idea was for the ages that were, where the vaccine is available to them, that we really focused on where it wasn't with that. So we can keep the numbers lower. This is in one case where our small numbers really do help us be able to address the.
Aside from the youngest kids,
Mhm.
what are our class sizes looking like K-12? That's my question.
Generally, we have about average class size of about 16, 18 students in a classroom. So we can surely meet the 3-foot rule for everybody, and we are keeping the plexiglass barriers up, and we still have the air scrubbers. We are still disinfecting and cleaning. We're doing all of those things still. We're not just saying it's gone, we're just going back to complete normal. But starting somewhere and incentivizing when it is good, and this is what it looks like when it's good, really does help, get a lot
And
more.
a 3-foot distance with no mask, what does that mean in terms of quarantining a class of 16 or 18 students?
The same rules would apply for quarantine, so anyone who's in close contact, so we have strict seating chart data that we have to use, so every teacher keeps strict track of where everybody is seated. Cafeterias as well, so when we have those seating plans, so it's anyone within the 6-foot range. If there's no mask, we have to use the 6-foot.
Yeah.
So anyone in that area, and if they're unmasked, yeah, you have the chance of being quarantined. So that's another incentive for those who may want to send their children with masks. If I just want to avoid quarantine altogether and ask the teacher, can you sit my child next to the other child wearing a mask? That's something that to be weighed and considered. Yeah. Mm-hmm.
all right, any other questions for Dr. Grimsley? Great. The next thing, thank you, Dr. Grimsley. So we may be back to you. Any discussion within the board on the topic? Our current posture that we left the last board meeting was that we would strongly encourage parents to mask their children, but it was not going to be mandated. We're returning to school 5 days a week from today,
Yay.
right? So our hope was to re-engage school and get things back to normal for a child. I think to give the parents the flexibility, if they wanted to send their child with a mask, they could certainly do that thing, but it was up to the family. And of course, a lot of discussion's been going on in the community, and been getting a lot of emails and phone calls, and obviously it's a sensitive topic, but our current posture is that we strongly encourage, but not dictated. So the matter that we have tonight is to have the discussion amongst the board to make sure we have agreement that we're ready to start school, and what is the posture? Is it the current posture, or are we going to change that posture? So if there's anybody on the board who would like to discuss that before we go into public comment. Anybody?
Yeah, I put some ideas together, and I'd like to share those, if I may.
Could you speak close to your mic?
Speak up, is that better?
Closer to your mic.
Mr. Mills, I've listened to many community members, parents and non-parents, and I've spent many hours reading articles and study related to the Delta variant. And as always, I want to put students and staff first in my thoughts. Goals and desires and outcomes for opening a school that I would like to share. I think it's important that we follow the science and the data. has been expressed, the educational regulations. I think all students and staff in school 5 days a week is paramount. I think we need to maintain a safe environment, provide challenging instruction, ensure that mitigating steps are taken to reduce the spread of the Delta variant. I think we need to provide students, staff, and parents with the support that they need during these times. I think we need to provide the staff with a normal school experience as possible. Every parent should feel comfortable sending their child to school. I do think that all students on the bus, and I'm not sure we said this, needs to be, and that's required, that they wear a mask.
It is, yeah.
And while no one enjoys wearing a mask, especially me, masks should be strongly encouraged for all persons in the school. Masks should be worn while students are in high population settings. Parents should have an option to opt their child out of mask wearing with a formal opt-out form explaining the risks and responsibilities of opting out. I think the superintendent will continually monitor the COVID dashboard and inform the school population of any changes. Mitigation practice should be adjusted fluidly with student and staff safety at the forefront. We need to stay safe and have a great school year. And I truly believe that if everybody works together, that will happen. Those are my thoughts.
Thanks, Larry. So just to be clear, we did leave here last month saying that the mass transit masking is mandatory. So every child on a bus would have to be wearing a mask while they're on the bus. That's a federal guideline that we can't, we're not going to be discounting in any way. So that's good. I appreciate you bringing that up. All right, is there anyone else?
Yeah, I have some thoughts as well. So as we discussed at the July 13th school board meeting, we aligned our policy on COVID-19 mitigation with the state's more relaxed COVID-19 policy. It means that we will recommend but not require masking. And I would like to, if we maintain that policy, I'd really like to dig deeper into how we can have that remain a parental choice rather than a student choice with something like a form that Larry Grove suggested. It shouldn't be an arbitrary student choice at a moment in terms of peer pressure. I'm the only one masked here. I was in a high transmission area earlier today with my work, and I felt that it was probably the best choice for me to wear a mask, even though you might think I look silly, but it's also school spirit, Rappahannock County, you know. And many people have actually contacted me who would not attend a meeting like this, quite frankly, because they do not feel that it would be safe to be in a large group of unmasked people like we are in today, and people following the news and the Delta variant, and people who are in contact with those who might have mitigating health circumstances. A lot of people live with people who are infirm. So after our meeting on July 13th, less than a week afterwards, the American Academy for Pediatrics recommended wearing masks for everybody who is unvaccinated, under age 12, and their teachers. That was the first thing that happened. Then this past week, just this very week, the rapid increase in the Delta variant in the U.S., the CDC is now, as Dr. Grimsley pointed out, recommending masking for all in K-12 schools. It's because masking some people, but not everyone in a group, isn't an effective way to prevent the spread of COVID, especially the Delta variant, which is more transmissible, according to many studies, than something like Ebola. So it's a different animal that we're dealing with right now than we were last fall. In some cases, vaccinated people can catch and carry the Delta variant without knowing it and spread it. Last week, I had both my kids were in urgent care with colds. They both were tested for COVID. They both were tested because at the urgent care that I went to, they have seen breakthrough cases of the Delta variant in vaccinated kids. That gave me pause as a parent. You know, I thought I was doing the best I could to protect my kids. As we get towards back to school time, and we will surely have in-person 5-day-a-week school, I'm very excited for that, and I think we all are. I'm just very worried about the potential for the Delta variant of COVID to disrupt our school and to harm members of our community coming into the fall. And I think we should do all we can to limit its spread. We've heard time and again at our school board meetings throughout this past year that our students and staff did really well with masking, that they were able, I mean, the proof is in the pudding. We were able to keep our doors open for the whole school year with a simple piece of cloth on people's faces while they were indoors. People commented that they liked the outdoor mask breaks, and that gave them another social opportunity. That's something. It also allowed us to be in school. People who were online really did suffer. People who were 2 days online suffered. I don't want to go back to 2-day online. I want to remain 5 days open, and that's my view. Our teachers do have just a huge task ahead of them to curtail learning loss from a year and a half of school that's been disrupted by the ongoing pandemic. We owe it to them to do all we can to keep them well and to limit potential sick days. A lot of our students have contact with people outside of school, even caregivers outside of school, grandparents who take care of them in their homes, who could bring home unknowing a highly contagious variant, and that would be about the biggest blow to mental health I could imagine. Losing your caregiver because of going to school. That's like the worst thing I can imagine. Way worse than acne. That's the only person who's been anti-mask who has contacted me and said that my teenager had acne because of a mask. That's hard to weigh against the potential for infecting a loved one or caregiver. Currently, if you look on the VDH dashboard, we have substantial community transmission. We're full of senior citizens as a county, and even when vaccinated, they might can contract a case of the Delta variant. If our goal, which I believe it is to remain open and to enjoy all the benefits of in-person school for everyone, we should continue to enact the same policy we had at the end of the last school year. Indoor masking for everyone. It's recommended by the CDC, the American Academy for Pediatrics. It's not unlikely that VDH will follow suit. It would just leave us with the same way that it was at the end of the last school year, what the students had already become used to at the end of the last school year. We can continue to have healthy outdoor mask breaks. We can continue to innovate in outdoor learning and give the kids more fresh air, which I think is something as most Rappahannock County citizens see the value of that as well. As we all do on this board, I hope and I pray for a wonderful and healthy year of in-person school. And we need the learning and the growth that will go with it. I will vote only to extend the indoor masking policy in this school year, starting off. I think that we can relax it later on, but in good conscience, I can see so many more pros of continuing the same policy we had than cons, and that's my position. Unfortunately, the many people who contacted me, most of them are not in this room, and I can tell by many of the stances in this room that many of you don't agree with me, and we do strive for collegiality, so I just wanted to lay out my position and also the reasoning. So thank you.
Thanks. Anyone else?
I think that the mask mandate has run its course. I think the fact that people still get COVID with vaccinations, I think the mask mandate is a shiny Band-Aid, the same kind I used to put on my daughter when she would stub her toe and cry for one. It made her feel better.
Speak up, please.
I think the mask mandate, you hear me, is a shiny Band-Aid like I used to put on my daughter when she'd stub her toe, and it made her feel better. I don't think it's saving anybody's life at the end of the day. I think it makes us feel better. It's a crutch. I've worn everything from an SCBA in the fire department to the cloth mask like Miss Bynum has on. Outside the SCBA, it doesn't stop everything. If it did, a lot less people would have COVID. You're containing a big cluster of nasty germs on your face. It does cause acne. It's broken mine out. We were washing our hands and wearing masks and sanitizing. One of the gentlemen I work with is OCD about washing his hands and then sanitizing, sometimes before and after he washes his hands. He still had a horrible case. It's going to run its course. I think it has. I could be wrong. At the end of the day, we represent the people in our district. 80-20 are against the mask mandate in my district. Personal emails, school emails, phone calls, to the grocery store, at the beach. I've run into Rappahannock everywhere I've gone. 80-20 are against it. People have had enough of what has been told to me, and I agree, is fear-mongering. It's a Band-Aid. It makes you feel better. We're still doing social distancing. We spent thousands on air scrubbers. We still have plastic shields in place. We're still at least 3 feet apart or more. Class sizes are reduced. We're trying to get kids back in school. We've had a horrible uptick nationwide with mental health. Kids are committing suicide. Social workers are going crazy. There's all kinds of cases. The more normal, the better. I'm not in favor of licking doorknobs and turning all these little curtain climbers loose, unsupervised. Mrs. Montague is still with us. God bless her. She's probably got the classroom that touches everything and everyone the most out of anybody in this school, and we haven't lost a soul. I've had COVID. It was bad, but it wasn't horrible. Have people died from it? Yes, they have. It is god-awful tragic. Every single one. But we can't live in fear forever and keep hiding behind it and hoping and praying. At some point, we got to move on. As far as my district, that I've been told, and it's not everybody's opinion, it's about 80-20 in favor of being reactive with the policy we have and adjusting as need. So keep in favor of what we have in place. If we see a huge upswing in cases are transmitted, then we have to, in good conscience, adjust and take more stringent precautions.
And
But
I think
until that need arises, why put that burden on people? And it is a parent's choice. You're responsible for your child just like you are your own health. You know what's best for you and your family, whether it's religious or personal or moral, whatever reasons. If you send your child to school with a mask, they should be wearing that mask. If you don't want them to, you don't want them to. You know what's best.
the process that we have in place is proven. It's data-driven. It has worked for us in the past. It's agile. We responded within hours of incidents that occurred in our school last year. And I believe it's a process that it's effective, an effective model. I was going to ask this though, Shannon. One of those sites that we were using for data showed us a substantial when we were not. The site was in error.
Well, no. If you use the CDC map of your track per 100,000, when you have a population of 7,500 or less, that puts 2 cases into an actual like 7 to 10 case rank. So even just a couple can put you in. And I know myself and our EMS supervisor, Sean Polster, also contacted the health departments on this and our epidemiologists and everything. Like, we need to know right away because everything we were trained to monitor says a completely different story. So both of us did that without knowing the other had done it. So we had a lot of emails coming back from our health director and our local public health coordinator and everything saying, no, small districts, it's still, you can't really use that to determine community transmission with accuracy. It's more of a comprehensive approach of many data points.
Right.
You can't use that one because the rate gets so thrown off. However, regionally, if you can look at that might give you an idea of a sense of what's going on.
So we have shown in the last year the ability to escalate and de-escalate with the situation that we're managing here within the school system, at the elementary and at the high school. And we've been managing that well. I'd like to say we did it. I didn't have a whole lot to do with it. This STAR team put together a plan, and my job was to say good job. So it is a great model. It has been copied by other districts. The preponderance of people, whether it's through the survey or through email, or I'm guessing tonight, we'll find out shortly, I'm sure, is to not mandate a mask. And I'm in favor of keeping our current posture, which is to strongly encourage people, but the parents have dominion. The comment came up about an opt-out letter, and the only advantage I can see to an opt-out is it would give the schools something in writing that tells them that this child that's not wearing a mask, that's what their parents want. Now, that might be a benefit. However, the other thing I start thinking about is some poor teacher who now has, 30 or 80 pieces of paper that she's got to sift through to see if this one has a piece of paper or not. So logistically, I'm thinking that it's unnecessary, or it's just going to be yet another burden for teachers. So where I'm at today is that we maintain our posture that we had when we were here at the last meeting. Masks are going to be worn on buses. Students have plexiglass shields and will return to the classroom with a mask only if their parents desire them to have one. So that's where you'll find me at this particular moment. But you're the last one we haven't heard from.
I agree. It's been working. I think it will work again. And if you have the option of wearing a mask, wear it. If you don't want to, you don't have to. And it's not going to go away overnight, but so far we've been pretty successful, and I don't think we're going to change in the sense that we are regulating and catching the cases, and if we have to quarantine, we quarantine. If we have to require a mask, we require it. Right now, I feel that what we were doing and what we have been doing is successful. No reason to all of a sudden demand you have to wear a mask. I think if it's optional, I also think it might be a good idea to have a paper saying the parents decide that this is what they want to do, but I don't think it's absolutely necessary. So I'm with the majority and think we keep what we have.
Can I ask a question of Dr. Grimsley? I'm sorry. I didn't mean to interrupt you, Ms. Meyer. Do you have more to say?
Say it again.
I just wanted to ask one question.
Okay, she's finished.
So is there a remote learning option that we're going to be offering for the 30% who would like to have all masked?
So if the Senate bill requires that we, and that's now General Assembly law, does require that we offer in-person, does not require virtual options unless there's an emergency. However, what we have been doing is if we do get requests, we look at that data really carefully, and we have the right to deny that, especially if we have a track record that distance learning was not successful for a student, because our primary objective this year is to ameliorate any COVID impacts, especially with learning loss. So you may not be approved for that depending on track record and where we need you to be, but that has to be requested through the principal.
All right, is there any other questions or comments?
I've got a question for
Yeah.
Dr. Grimsley. Last year, when students were at their learning stations behind the plexiglass, were they required to wear a mask at that time?
Not initially. Last year, if you recall, we said it was on the buses, and when you get to class, when you're at your seat, you can remove them.
That's why I thought.
So we started the year until the executive order came in place. I think it was 53 at that point, the first executive order that then mandated them in schools. Then we didn't really have a choice because that was a governor's order. But up until then, we started the year pretty much the same way.
Right, that's what I thought. And that makes sense to me.
Right. So before we begin public comment, I just thought I'd get the sense of the room so that we can all take a look. I was going to ask how many folks here, if you could raise your hand, how many folks here are either a parent of a student or an employee or a relative of an employee. Do you mind raising your hand? Yeah. Okay, thank you. And what if I asked you, has everybody had visibility to the plan that we implemented last year, the way The things that Shannon presented to you are public documents that outline the plan that we implemented, that is this model, this process. How many people have actually seen that process or viewed it? Yeah, good. And if I asked you tonight, because you may or may not decide to stand up and speak to us, but of those of you that are here, how many are in favor of a mask mandate from the school board tonight? Thank you. Thank you. Hey, one of my former board members, Aileen Johnson, I know you don't want to be here for me to tell stories. I'm just tell you a real short one. She used to say to me, it's good for us to debate things, and we can disagree, but we don't need to be disagreeable. Pretty simple concept. We can disagree, but we don't need to be disagreeable. So at this time, before we open the podium for public comment, I'm just going to ask you to try to keep your comments to something reasonable. We typically limit comments to 3 minutes so that we're not here at midnight. So I'm going to ask you to come to the podium. If you get to 3 minutes, I'll ask you to conclude your remarks, and we will move on to the next person. When you come up, if you would state your name and the district that you come from. If you don't know it, we'll help you out. That's also helpful. Is there anyone that would like to address the board this evening? Who wants to go first? Yes, sir. Good evening.
I'm Roy Ellis from Stonewall, Hawthorne. Acoustics in this room is terrible. I didn't hear any of the superintendent's presentation. A little of what the board said. So
You need to be that far from the mic.
okay. All right, let's start the clock. This is my second school board meeting ever. It's been nice being part of the silent majority while government took care of business. Wasn't too smart. For example, the Marxist movement is busting through our TV screens. In the Deep South, recently, there was 33 county school boards in Tennessee found to be using wit and wisdom in their K-5 curriculum. Took me to my knees to hear that. Our Board of Supervisors caved in to cancel culture and renaming the Lord Fairfax Community College. We must be vigilant. I have 2 grandkids who are starting the school this year as seniors. Last school year was close to a total loss academically, and sports activities got jerked around, almost traumatic at times. Internet is not a replacement for in-class instruction. I commend the teaching staff and the students who got through that period last year. Most parents and grandparents went along to get along, thinking that the 1-year loss would be the end of it. Now we're at the end of our rope. We won't tolerate any further government interference as it relates to the health and well-being of our young people. Masking is mental and physical child abuse and should be treated as such. Government has zero authority to mandate mask, vaccine, school lockdowns, and similar. Health decisions for young people are between the young person, their parents, and their family health care providers. We elect people to serve in government and expect them to use common sense and to obey the Constitution. The Constitution gives no authority to government to manage the health care of the student population, to mandate masking, force vaccinations, or invoke school lockdowns. Should this board move to implement any government mandate relating to the Chinese virus, I'll work my tail off toward removing responsible members from their elected position. I should also make you aware that my grandkids will turn 18 in December. I pray that common sense will prevail and our students will have a full, unimpeded school year. Thank you.
Thank you, Mr. House. Who will be next? Yes, sir.
School board member members, thank you. Thank you so much for having me. My name is Dr. Matty Lido. I believe my district is the Piedmont District. Christine Smith, yes, correct? Okay, good. Started off on the right foot. So masks have been studied for decades. There's tons of empirical data on masks. I've actually written a letter to the Virginia Health Commissioner, Dr. M. Norman Oliver, about this. He wasn't too pleased with my letter, but he could not dispute the science and the data that I presented to him. Furthermore, current studies also conclude with the past studies that masks are not effective at stopping the transmissions of influenza-like viruses. Now, the coronavirus is 70 nanometers. An influenza virus is about 120 nanometers. So even if you wore an N95 mask filtered down to 1 micron, how would you overcome the sheer physics of keeping out a 70 nanometer coronavirus? It is absolutely impossible. Now, as far as the vaccinations go, if you follow the data, excuse me 1 minute here. Okay, that's a little better. If you follow the data on the breakthrough cases, as well as the CDC data marking death, unexplained death, spontaneous miscarriage, and serious injury from the vaccination, which has been widely unreported by the CDC's own admission, theirs is at least 10 times underreported. The data shows that this is neither a completely effective nor safe solution. Now, even if the vaccination was 100% effective, the COVID vaccines have killed more people than all 70 plus vaccines combined over the past 30 years. Now, when the pandemic first began, I was very naive. I saw a problem and I knew a solution. I already know a tried and true treatment for antimicrobial excellence. From my humanitarian work in Haiti and South America, I've come to know medical ozone very well, and I've used it many times myself since 2012. Now, throughout the pandemic, I've been in contact with doctors from New York, California, Michigan, as well as Colorado, who are actually successfully treating COVID patients with medical ozone. So I sent out over about 150 communications, texts, phone calls, emails to the powers that be. Now, medical ozone is widely unknown, but it's extremely safe, and it's even powerful enough to eradicate Ebola. And that data is well documented in the Journal of Infectious Disease and Epidemiology. And I personally know Dr. Howard Robbins, who was one of the doctors on that mission trip to Sierra Leone. Now, unfortunately, medical ozone is not so easy to come by, and unfortunately, no one really cared about my solution as far as the powers that be. And I think it's that way because I think this path has been chosen for all of us, regardless if we want to tread it or not. See, it's like there's a clear message coming down that, hey, these are your choices, mask or vaccine, right? That's it. That's the way it is. Okay. The thing is that my health is my responsibility and your health is your responsibility. And I'm not interested in forcing my solutions on you, and I'm opposed to any solution being forced upon me or anyone else, especially children. Now, we are free to choose our own way. We're very fortunate to live in a country where we have this choice. I've traveled all over the world as a doctor of chiropractic, doing humanitarian work, and I can tell you that America is the exception and not the rule in a very good way. Now, personally, I had COVID. It wasn't really much to me because I'm fortunate to have a high level of metabolic health. But I now know that I have natural immunity, which, according to the data and my 20 plus years studying immunology and metabolic health, I know that there is nothing better than natural immunity to prevent infection. So for me, why would I wear a mask? Why would I take a vaccination? Especially because I know all of the data. So there's a way out of this. So what is the most promising solution? What I've discovered, once again, through the data, but even more importantly, talking with doctors that are actually treating COVID patients. Isn't that amazing to actually go and talk to the doctors that are actually treating the patients rather than getting the information from an elected official or a bureaucrat that never has treated a patient in their entire life? I mean, it's a pretty novel idea. So I've talked to these doctors, and what I'm learning is that the most promised solution to end all of this is actually ivermectin. When 1,000+ doctors have nearly a 100% success rate in treating and eradicating COVID with no detrimental side effects with a treatment that is also safe for children, one has to consider that this is a much better alternative than a totalitarian forcefulness of mask, vaccine, and lockdown mandates that are neither safe nor completely effective. Now, fortunately, this solution has been discovered and presented by courageous and ethical doctors who have come forth. And let me tell you, when you come forth, you get hammered. I've gotten hammered for the things I've done, but it's okay because fear as a principle to guide us through this will not win. Courage, reason, and logic will get us through all of this. So we have these ethical and courageous doctors coming forth and telling us about their success with ivermectin. And let me tell you something, how fortunate we are right here in Rappahannock County to have a doctor that actually treats COVID patients with ivermectin. He's my family doctor, and I'm very honored to have him in this community, a true expert who actually treats COVID patients. I have sources if any of you would like to see him, and I just want to thank you for allowing me to come up and speak. Thanks so much.
Maddie, it's always good to have leave-behind materials for the board. If you have that information, you can leave it. We'll make sure it gets distributed. All right, thank you, sir. All right, who will be next? Yes, sir. Oh. Evening, bro.
Good evening. How are you all?
Good.
Thank you for allowing me to speak. Thank you, Maddie, for a good speech. I'm Brooke Miller. I'm a family physician here in Rappahannock County. My wife, Ann, is sitting over there. We run the small clinic right across the highway. And just a little bit about me. I graduated from Rappahannock County High School in 1978. I was salutatorian. Yeah, I'm really old. I then went to Virginia Tech and received my Bachelor of Science at Virginia Tech in biology. And I was awarded the Honorary Society of Phi Beta Kappa. I graduated magna cum laude. I went to University of Virginia, where I met my lovely wife. The best day of my life was the day I met her. And I graduated from medical school. And I often come back to something that I learned in medical school. I remember in 1982, I was 21 years old. I was sitting in a large auditorium with about 200 medical students. I was excited. I was scared. I was thinking I was going to learn all about disease and prevention and treatment in that 4 years. But probably, and I'm glad my kids aren't here because they've heard me say this many times, probably the most important thing I've ever learned was that very first day in class when a professor got up and said, half of everything we teach you in medical school will later be proven wrong. We just don't know which half. And that served me well. I did not believe him at the time, but I sure believe him today. I'm a person of science. Everything that I do is based on scientific fact, whether it be what I've seen in my experience. I have yet to see a study that conclusively shows that masks prevent the spread of coronavirus. I don't think there are any. If anybody has any studies, I would be more than willing to look at them and possibly change my mind. I think the mask has significant potential for harm to children. And we're talking about children that have a 99.998% survivability from COVID. It's less detrimental in children than influenza is, and we don't mandate masks for influenza. So keep that in mind when we talk about these mandates and what are the effects that all of this has had on children. I heard Mr. Ellis, or maybe this gentleman over here, talk about suicide. I've seen it. I've seen kids come into my practice, and it's very detrimental. We need to protect children. Children don't need to protect us. So I encourage you, well, I'll bring up one other thing. You take the statistics worldwide. The United Kingdom is probably the highest mandated, highest vaccinated country in the world. They have mask mandates. They've closed down their businesses, their economies, and coronavirus is exploding there. You look at Sweden. Sweden followed a doctrine by something called the Great Barrington Declaration. And I don't know if anybody has heard of the Great Barrington Declaration, but if you haven't, you should look it up and you should read it. And Sweden basically has voluntary masking. They didn't close schools. They didn't close businesses. And 37% of the population is vaccinated for COVID-19. To the best of my knowledge, the last 2 weeks there's not been a single death in Sweden from COVID. It's pretty much non-existent. The death rate in the United States has gone down dramatically. It's lower than it's been in 20 years. I mean, since March of 2020. We're developing a natural immunity, and like Dr. Alito said, natural immunity is the greatest weapon we have. Pfizer even came out the other day and said we're not going to be able to vaccinate our way out of this pandemic. What's happening now, in my opinion, and this is my opinion, this isn't backed up by fact, but this is my opinion, is that we're seeing a Delta variant that was selected for by mass vaccination. The virus wants to survive. It has become more virulent. What does more virulent mean? More virulent means more infective. The common cold is virulent. The common cold is not deadly. Hopefully, and I'm thinking and hopefully, that the Delta variant will be less deadly. And the people that have been vaccinated are going to be prone to it. But they will have a degree of immunity, and also with less virulence, hopefully they will develop a natural immunity, because that's the only thing that's going to get us out of this is natural immunity. There are medications that we can use, and I've used them with success. Unfortunately, it's been very politically suppressed by the media, and I just hope you guys take all the information into account. And I meant that. If someone can show me one study that shows that masks prevent the spread of COVID. I'm not talking about me spitting out in the audience. I'm talking about the spread of COVID. I'd be interested to see it, because I might change my mind. Thank you.
Thanks. Who'll be next? Anybody?
Good evening. My name is Terry Dixon. I'm with Stonewall Hawthorne District. And note to self, when you speak at these events, and I've not only been to a couple school board meetings, I've been to some of the joint board of supervisors school board meetings, because you talk about budgets and taxes and things like that. But I've not been to these, so note to self, always speak before the smart guys go, because it's going to make you a lot smarter to be in front of the smart guys like Mr. Ellis and not me. Anyway, so I'm here tonight on a Wednesday night, and if you hadn't noticed, it's extremely nice outside. I have a barbecue waiting, but I thought when I heard about this mask mandate meeting, the barbecue waits and our dogs wait, because I just have to say my piece about mandating little children to wear masks going to school. Last year was awful. It was absolutely awful with kids not in school. I mean, to my knowledge, kids lost a year of education. This year, we got to get back. We got to bring them back. We got to get them in school. We got to get them motivated and teach the children. I was on an airplane this past week. Now, how masks work, I don't believe masks work, and I tell you why, just because I'm a kind of a technical guy. If I have a mask on and I have gaps coming through the side, and on an airplane you have 250 people in a little tube flying across the country with recirculating air, and they're moving their masks and they're taking them off, and you're taking a sip and they're to blow your nose and you're all this kind of stuff. You have gaps coming out. I guarantee if anybody had COVID or any kind of virus on that plane, it's spread to everybody. That's my opinion on masks. They don't work, and it's fear. It's absolute fear, and I don't know why a large population, percentage of our population is susceptible to that fear, but in my opinion, that is just fear. It is not keeping people safe, it is just fear. So I would just highly suggest that the policy that you had as of last month's meeting be kept in place. If families want their kids to wear masks, if you want to wear a mask, I'm all for it. If you want to get a vaccine, I'm all for it. But let's give us a choice. Let's let families decide for their kids of what they think is best and keep the policy the same. Thank you all.
Thank you, Mr. Dixon. Who'll be next?
Hi there, I'm Dave.
Uh-oh. Wow.
Yeah, you broke it.
Can you test it?
Yeah,
There we go.
all right, I'm Dan Ellis. Miss Meyer would know me as Danny, 6th grade. I came up here, I don't really like getting and talking in front of stuff like this, but I'm representing my kids today, and I'm gonna speak for them, because they won't come here to do it. But I have 2 twins that will be seniors this year, and they've already missed out basically on a year and a half of school. And it has really been hard for me to watch that. And the school did a good job last year of at least getting them in school some, which is better than most schools did in the state. But I just watched them suffer all year. Courtney knows my kids. They're very well-rounded kids. They play sports. They're good in school. Sociable kids. By the end of the school year, because of the mask and all the stuff that they have to do, like the plexiglass and staying 6 feet social distance, they were just worn out of school. I mean, they did not enjoy going to school. And I know last year was a different beast, but I am all for ending that and making things to where they can enjoy school. My daughter, who is very social, at the end of the school year, she opted out the last 6 weeks of school because she couldn't stand it anymore. And she did the virtual. I didn't want her to do that, but she was absolutely miserable. It's just painful to go to school all day and wear masks and not talk to anybody, not eat lunch like normal people in a cafeteria and socialize. A big part of school is socialization. My other kid, Luke, he went to school, but every day was like pulling teeth with him to get him to go. He just hated it. So I'm not for masks at all. And actually last year they missed out on, they had some kind of a prom, but you couldn't only dance with some people at a certain table. That stuff is ridiculous, and we need to get rid of that. We need to be able to let our grandparents and anybody that wants to come to basketball games, volleyball games. It just was a ridiculous year. And I'd be remiss if I didn't get up here and support my kids for that.
Thank you, Mr. Ellis. Thank you. Who'll be next? Yes, ma'am.
Good evening, everybody. I'm Cassia Gaynor from the Stonewall District. So the first thing that I want to talk about is just how earlier it was mentioned about mental health with the mask and everything, and I think that's a very big point to make. It was really hard on a lot of us, especially people who already struggled with anxiety and depression and thoughts. that were more negative to cover up their faces, and you couldn't see people's expressions. And I have younger cousins who went to school and people who have younger siblings who also went to school. And for the little kids, it was really hard because now they don't know how to look at people. They don't know that you're supposed to look people in the eyes and that you can smile at strangers and all these things. And so I think overall, through all the age groups, it's really messed with us on an emotional level and on a mental level in controlling how we feel and how we see the world now. On that thought, I'm really, really happy that it's going to be optional now. Because I know, like saying earlier, for Sarah Beth and Luke, it was like pulling teeth to come to school. That's how it was for me and my sister, and for lots of our friends. It was, why go through all of this if you can't even talk to people anymore? Social aspect is 95% of the reason we go, in all honesty. So I'm very happy that's optional. With that said, for the children who their parents would like them to wear masks, that is a family decision. And if they want to do that, that should completely be respected. But I think mask breaks then should be more of a focus for our schools. Yes, they were an idea last year. And yes, in some cases they did happen. But we had a lot of teachers who, they got busy. They were in the middle of a lesson. They did this, they did that. Some of them just didn't want to go out, and they assumed that other teachers took those students out. Well, for my little sister and for me, there was days where I had all my classes set up and none of the teachers took us out. We didn't get mask breaks. If we did, they were last minute thoughts, 2 minutes before class ended, everybody rush back into the school so you can grab your stuff. So I think with that said, maybe especially for the children who are still deciding to wear masks, and for children in general, getting outside is a very healthy thing to do. That 10 minutes in the end of first block and 10 minutes in the beginning of third, that the entire school decides, or this half of the building decides, we're going to go outside. That way no child is set up with a schedule where they have nonstop 8 hours of the mask, if that's what they decide to do. I also think why the opting out paper is, if that's like a school thing, whatever that might be, where it helps you guys on that end, it's probably a good idea. But I also know that no 16-year-old is going to put on a mask just because his parents didn't sign a paper. They do not care. There's no way that you'll get them to do that. So I think that those were my main thoughts. And then the only other thing I could say is the plexiglass shields, if we're keeping those up, fantastic, great. But maybe the thoughts on how the classrooms are set up could be different, because we have desks that are half the size of this podium, and then you put plexiglass on them, and then they only fit the Chromebook. And I don't know where to put my notebook to write down stuff. So that makes life a little bit more difficult where it doesn't need to be difficult. And so those are my thoughts. Thank you.
Hey, just so everybody knows, we have gotten used to hearing from Cassie. She is our school board, what's her title actually?
Liaison.
Liaison. She's the school board liaison for the student body. And she has so many times connected us with that student body just like she did. She's valuable and she does really well. So you should applaud her, really. She does a great job. And we need your perspective. I appreciate that. Is there anybody else who wants to follow Cassia?
Mr. Bills, it's good to see her in person.
In person, yeah. We
Yes.
see her online. Yeah, right?
Hello, good evening. My name is Jay Allen. I live in the Wakefield district. I do not have any children, grandchildren, or great-grandchildren who live in Virginia. So I see myself as a Rappahannock County outsider with a different perspective. I think masks are valuable. I think it would be good to make them mandated so kids don't feel ostracized if their family makes a choice that doesn't jive with their wishes to be part of the group at school. I know this is not a popular position that I'm espousing, but I think it has some value. Kids can't be vaccinated. People in this room, as well-intentioned as all of us are, could be carriers of this new variant. And I would hate to be thinking that any of us would cause some child's life to be short-circuited because we didn't do everything that we could to take care of them. And to me, I hate masks probably as much as anybody here, but it's not a hard thing to do. You don't have to be a great athlete. You don't have to be eligible for Mensa. You just put it on, wear it, and take it off when you're not around kids. So, thank you.
Thank you, Mr. Allen. Who will be next? Yes, ma'am.
I am Beth Gaynor from yours, whatever that is.
Stonewall Hawthorne.
Stonewall. I just wanted to say on the point of the opt-out forms, I think that logistically it could be a huge nightmare. If parents decide to change one day, yes, they can send the form in. How does that form get to the teacher? How does that teacher file a wage, know which class that's in? And then you have the fact that what Cassio says is true. If you have a teenager who sees that his friends aren't wearing a mask and chooses for himself that he is not going to wear a mask, how is that teacher going to enforce that? I have been a substitute several years ago in the high school, and I had a student lay on the floor, would not get up. Other teacher came in, couldn't get the student up. They said, just leave him there. How is that any different? I can't pick that student up. I can't force that mask on his face. The teachers are not going to be able to force that mask on his face. So does he get detention? Does he get ISS? What is going to happen to these students that won't put a mask on? So yes, I think the opt-out form, if you need that for legalities, may be something, but I do not think it's going to be enforceable.
Right. Thank you. Who will be next? Anybody? This young lady's making her way to the front. Hold on, hold on.
Whoops,
We got a young lady in front of you. Coming from the far back, hold on. Get you next.
Hello, my name is Vanessa Lynn Fraser and I'm from Stonewall. I think if we would go back to mask, there would be no point of going to school because I don't know if it's just me, but I can't understand anybody when they're talking in mask. No. So if we went back, there would really be no point to me. And also, if I would have to wear a mask, I wouldn't be learning anything anyway. Because when I wear a mask, I get really dizzy. And, you know, when you get dizzy, your brain doesn't really work anyway. So when you're sitting there in class all dizzy, you're not learning anything because you can't comprehend anything. So I think that it should be if you want to. And I don't think you should have to have a parent's permission because students have opinions too. It's not just on their parents. And if you don't want to wear a mask, you don't wear a mask. If you want to wear a mask, wear a mask. I don't care what you do. But I figure that it should be your opinion, not all on your family or all on your parents or guardian or whatever. So I think that it should be if you want to or you don't want to.
Thank you. Ma'am? Yes.
Hi, I'm Rosanna Reed. I'm with Stonewall Hawthorne. I just want to say that I'm definitely in favor of keeping our current posture across the board. No mask mandate for the kids and no opt-out paper. I think our school does a wonderful job. I'm sure they'll handle anything as it comes up. with no problem. I think the smaller classes and using the plexiglass is still a good idea. I definitely think the masks should be up to the families, and even in the high school and middle school, I know some of the kids have their own feelings about the masks, and they're not comfortable with it on all the time and stuff like that. So, I mean, I definitely think that they'll have their mask with them because they have to wear it on the bus. But if at any time they want to put it on, it's up to them. They can put it on. Nobody's going to tell them, no, you can't put it on. But they're not going to be mandated that they've got to have it on, which I think is wonderful. Thank you.
Thank you. Anyone else this evening? Yes, come.
Hello, I'm Ashley Frazier from Stonewall, Hearthstone, and I am against mandating the mask. As you heard from my child, she does not like them. They make her really sick and dizzy, but I think it should be the choice of the family or the child, especially if they're older in the high school, let them pick. But I wanted to speak because I work in several counties around the state of Virginia. There are schools that are doing the paper that you all were talking about where they sign saying what they want their child to do. But out of the ones that I've talked to, they are all elementary and middle school. None of the high schools are doing it. And that is as far north as Loudoun and as far south as Bedford. That is my lovely driving route for work. And in the 16 different counties, different people that I work with, that I've talked to, it's mostly elementary schools that are doing that. Probably because your very opinionated teenagers will be very opinionated teenagers. But there are a few other schools doing it, and I just wanted to let you all know that is something other schools are doing if it was something you wanted to look into doing. But I do think it should be a family or child's choice. Thank you all. Have a good evening.
Thank you. Anyone else? Anyone else? Tip. Hi.
I wasn't going to talk, but then I thought, as a teacher, it's a different
It's your
perspective,
job.
but I'm also a parent.
Close.
Oh,
Closer.
I'm sorry. And I live in Woodville, and I used to I go to Scrabble to vote, and then they split our street.
Yeah.
So I think now I vote in Sperryville, so I guess it's Piedmont now. So I am also a teacher, but I'm also a parent. I'm a native of Rappahannock. This is my 20th year teaching. I'm getting old. So I debated whether to give my piece, and this is just my opinion. As a teacher, I did wear my mask last year because it was mandated, and I'm going to respect authority. That's what I do. That's what's expected of me. I teach pre-K. They're 4, some of them are 3, and they tried their best to keep their mask on. When they got behind their shields, they would take their mask off. I kept my mask on when I was interacting with them. And I will say we lost a lot of compassion and kindness and those smiles because some of my children I had this year, the only smile they saw was when they came into my room. And with the mask, you don't see that. I know we weren't supposed to hug or touch, but one of my children, when I reached my arm out to him on the first day, he shied away from me like I was going to hit him. But by April, he fell into my lap, and yes, I did hug and rock him because at that moment, science and virus goes out the window because first of all, I'm a loving, caring human being. I'm a teacher. I'm a mom, and that trumps everything else. Also, my daughter was in my pre-K classroom. My daughter was a preemie, born 2 months early, and I asked the doctor, is it safe for her, even though she's 4, is it safe for her to be in school? And he said yes, she would be fine. But I did notice some teachers were not comfortable when children sat down even 6 feet apart for them to take their mask off. And they would sit for 30 minutes with their mask on. When my pre-K children came back from those 30-minute classes that they've been wearing their mask, their faces were very red, and they would say, "Miss Montague, I don't fare very well. My head hurts." They would sit at their desk with their heads down for 10 to 15 minutes to regain their composure. If you know 4, 3, 5-year-olds, sitting down by choice for 10 to 15 minutes is probably not your normal thing. We had centers in the room, which was free play for them. I had students, because if you had 2 students together, they had to wear a mask to play. I had students choose to opt out of playing because keeping their mask on for the 30-minute center time was too much. And they said, "Can we please just go to our seats so we can take our mask off?" I am not about telling people what they need to do. I feel like, thank the Lord, we live in a free country right now. And I have a choice to whether I vaccinate. I should have a choice for my child's health because no one knows my child better or myself better than I do. But will I respect other people who choose to vaccinate or choose to wear their mask? I will, because isn't that what we're trying to teach our students, is that to be tolerant means you may not agree, but you do things out of respect, and we respect each other's opinions. So if I don't get the right to choose, how are we teaching our children? You have choices. It's up to you what choice you're going to make. Now, if we're around someone who has a low immune system, who's going through a sickness or treatment, of course, out of respect, I would wear my mask, but it's different when you're told you have no choice. So like I said, I will do what is requested of us, but I just feel like it just sets a different tone when you're given that option, because it makes you feel like, okay, they trust me as an adult, they trust me as a good citizen, and they trust me as a professional. I didn't need to be told to sanitize my hands or wash my tables because I did that way before. And I just feel like, okay, we're going to require kids in a class maybe to mandate a mask, but our sports teams play an hour-and-a-half basketball game and they're in each other's faces. We go outside, the playground, my poor little children sneeze, cough, they have no idea personal space, but I don't go behind them and wipe all the equipment. So I am all about keeping people safe, and I would never want anyone in my care to be harmed, and I will always do my best. But sometimes certain things are out of my control, but I just feel like having the option, and I just so respect all the hard work, Dr. Grimsley and the board, because I know ultimately we do want to do what's best. We all have the goal, but sometimes that looks like different things for different people. So thank you all for your time.
Thanks. Okay, who will be next? Anyone? Yes, ma'am.
Hi, my name is Andrea Payne. I'm a registered nurse and a frontline COVID worker. I'm in the Wakefield district, and I do have children that are in the Rappahannock County Public Schools. I just am going to be really quick, and I want to support Mrs. Montague. And the reason why, just a few pieces of information. I can throw all kinds of acronyms out there of different societies and different pieces of information, and everything can be argued. But one thing I do want to say to support Mrs. Montague, studies do show that after 3 minutes of wearing a mask, CO2 levels are increased 6 times the healthy level. Increases in CO2 physiologically and psychologically will lead to acute anxiety, headaches to support Mrs. Montague, drowsiness, decreased ability to concentrate, and decreased cognitive function. I am also a nursing professor. I do teach immunology, and I also do teach infection control to my students. So I do have a background in this. One other thing that I do want to mention to Mr. Euban's point is our mental health right now is extremely taxed. In the emergency department, I see increases in pediatric cases that come in every day. From the Virginia Medical Health Access Program, and I can provide any of this information to you, there has been an increase in the visits to the emergency room. The ER visits for mental health for 5 to 11-year-olds related to COVID has gone up 25%. 12 to 17-year-olds, 31. And 25% of 18 to 24-year-olds seen in the emergency room have reported suicidal ideation. In the state of Virginia, we have 2 counties out of all of our counties that have sufficient psychological support services. 25,000 children out of our 1.86 million have the ability to be treated. So, my point is, wearing the masks have a psychological and a physiological effect on our learning and on our mental health of our children. The mental health of our children right now is very important, and our services are very taxed, especially, I'm fighting other things too, including vaccine mandates, which is going to drastically decrease the amount of services that we're going to have available in our community. Our nurses are leaving, our physicians are leaving, and anybody else that's going to be mandated to this vaccine. This will affect that number. So because of that, I just want to make sure that everybody understands what this could do. And I want to make sure that everybody does have the option. If they do choose to have the the mask, that's up to them. But please understand what this can do in the future for your children's learning.
Thank you very much. Who will be next? Anyone? Yeah, I recognize this guy.
Surprise, surprise.
Surprise, surprise.
My name is Cameron Whalen from the Piedmont District. Probably shouldn't be saying a few things, but going to go ahead anyways. If you didn't know, I was a senior last year during the COVID crisis.
How can we forget you?
Exactly. But yeah, last year, in short, was a dumpster fire, in my opinion. It was just the amount of stress on everybody, students, faculty, parents. It was a disaster. But I think the main thing was the masks and keeping up with the masks. I'm not a scientific person, but my opinion is I don't think they work. I hated having to wear a mask. Every chance I could get, I would just slip it down and look for the teacher and then pull it back up when she looked or he looked. Sad to admit that, but I'd have to do it now. But truly, I think it would just add more stress to everybody's life. Again, with all the points, if you want to wear it, that's your choice. But that's just my 2 cents.
Thank you, Cameron. All right, anyone else? Ann?
I did not come prepared to speak, and I'm ashamed to say that this is my first school board meeting. I'm Ann Miller.
It's okay.
I'm so sorry,
don't
but I have to. And I'm not here. The only thing I want to say is I'm really impressed tonight. I'm impressed with all of you. I'm impressed with Dr. Grimsley, and I wanted to say it publicly. I'm just very proud of what we have here in Rappahannock County. So, thank you very much.
Thank you, Ann. Thanks. Anyone else this evening? All right, we're going to have move on to the next agenda on the item. Now, if we're going to maintain the posture that we had when we left at the last school board meeting, we don't need a motion. There's no motion to make. So at this time, if there's a board member that would like to make a motion, we'll entertain that motion now.
Could we have just a moment of discussion, Mr. Mills?
Sure.
So my understanding, our posture currently is that if our metrics do change, then we might go back to where we were at the end of the past year. Is that correct or incorrect?
So with the metrics, we will measure and layer on additional mitigation, primarily with quarantining procedures, the symptom list first. The masking, if the board wanted to enact that, that would be a policy decision that we would bring before the board with, like I said, without the executive order and those things in place. We have some enforceability things that we may want to talk about if we get to that point, but they will certainly be brought up for discussion. At each meeting, I will give you the data, just like last year, and we'll continue to have those discussions.
So I was thinking about that, and so I thought, you know what, does everybody know why we were wearing masks last year? It was mandated to us. We were mandated. So it's not that the board mandated anything. The state mandated us, and if things start ramping up and there's a mandate coming out of the school, it's going to be because it got passed down to us, all right? And so it's an important thing for all of us to know. But I would guess we're going to escalate as we see the need to escalate, and we're going to de-escalate by those same metrics. And that's been the success of our model so far.
And we have strategies, if I may, Mr. Mills, I'm sorry, but we do have strategies, and the administrative team have strategized with additional tiers for cohorting and different levels in the cafeterias just to better trace if needed as things, if things do ramp up and the data indicates. So we do have strategies to amp that up, but also empowering everybody with the knowledge, the data, if cases arise, and just making sure everyone knows, because people tend to make the right choices when they feel the risk is in front of them and they know what those risks are.
And I just had another question.
Yes.
I was curious, there was a lot of information and opinion shared here today, and that in some cases, what we are looking at is Department of Health and CDC information. When we communicate information as a school district, we should be communicating the information from the Department of Health and CDC when we help try to inform parents on their decisions. It doesn't seem like we have a quorum for a mask mandate, but we'll be providing information and metrics regularly to our students and staff.
Right. And Ms. Bynum, if I may, those dashboards are from the Department of Health and CDC, both of them all together. The VDH and the VDOE, Department of Education, collaborated to give schools interim guidance for K-12 and how you mitigate the virus. So they combined all of those things. So that is what we report out, is that data from those agencies.
Yeah.
Absolutely, yes.
Yeah, so that is vetted data that we will be basing our opinion on.
Yes.
Mm-hmm.
Mr. Mills, I would make a motion if I could.
Go ahead, Mr. Grove.
I move that we continue with what we finished with last year, with the expectation that if data changes, we give Dr. Grimsley the authority to make changes between board meetings, but we would be updated at each board meeting.
Okay, we have a motion from Mr. Grove. Did you capture that? Best you could. You can go to the videotape. Is there a second? Do we have a second?
Second.
We have a second from Ms. Meyer. Now, any discussion? I would only ask, isn't that what we're doing already?
That's my question, I'm sorry. So continuing what we did last year as far as the dynamic decision-making metrics over just the guidance for the masses.
Yeah, but
Is that
so this is, he said nothing about a mask.
I said we continue with the way we finished last year.
Right.
Which we
would
had
be-
masks last year.
We had masks last
That's
year.
what I'm confused about, because at the end, we still had Executive Order 79 in place, so we were masked at the end of last year.
Change it.
You can modify the motion.
I can
Mr.
modify
Grove.
the motion.
So
I would-
before you modify it, though, let's have more discussion. So like I said, it seemed to me that the thing that you expressed, Dr. Grimsley already had that guidance last year, because this team dynamically modified between board meetings based on the model. So they were already agile and within hours changing the posture of the school. I think they already have
That authority.
that authority
to do that.
and that everything's in place
And let's go back.
without the motion.
Let's go
But we
back
have a
to
motion
the
on the floor, so we got to deal with it. So I believe your intent is already being implemented. Do you agree or not agree?
Yes, I agree.
All right, so we're gonna do nothing, but we do have to vote on a motion. But I want the discussion to make sure that we see that there's that it's duplicative of our current stance. But we have a motion, and the only way to do it is to rescind the motion. Do you rescind the motion? It's not going to.
We're going to maintain our current standing from where we were in our last meeting, then that would be my desire.
Right.
Okay. So I'll rescind the vote. The motion.
The motion is rescinded, and there's no need to vote. I appreciate the information, Dr. Grimsley, that you share with us tonight. If anybody's here that would like to see a copy of that, it's available on the internet. If you don't have internet, I understand. You can get a copy of it at the school board office.
It will be.
And
It would be
we'll
on-
make sure you get a copy. It's good information so that you'll know what this is that we're using to judge escalation and de-escalation.
Mr. Mills, it would be on board docs, not just on the internet.
Right.
Yes.
But people that don't have internet are not going to get to board docs, right?
Yeah.
So there's no need to make a motion. Is there any other motion anybody wants to make while we're here?
Yeah, I'm going to just move that we maintain the masking guidance that we had at the end of the past school year, not keeping in mind that the Delta variant is among us. I would like to move that we actually
All right,
we'll keep with masking.
so that.
And I know I'm going to lose, but I just feel like I
So that
have to
is
move it
the
in
mask
good
mandate.
conscience.
So motion. So we have a motion from Ms. Bynum that we mandate masks for students. That was in accordance with Executive Order 79. I remember the number, or is it 97?
It's 79.
79. So we have a motion from Ms. Bynum. Is there a second?
With the ability to opt out for medical reasons.
Right. Is there a second? There's no second. The motion dies on the floor. Is there a motion to adjourn?
So moved.
We have a motion from Mr. Grove to adjourn. Is there a second?
Second.
We have a second from Mr. Rubin. All in favor, aye?
Aye.
Aye. Opposed, no. It's ordered. Thanks for coming. Appreciate you spending your evening here. Thank you very